Welcome to Module 4 of the presentation on identifying depression in your primary care practice. In this module, we'll talk about training staff on how to perform a screening, who should document the results, and how they should be documented. As part of preparing to begin the screening process, it's helpful to explain to the patient that the screening is a routine part of the doctor's examination and that it will help the doctor to get to know him or her. It's important to make eye contact and use a calm, friendly tone when discussing screenings with the patient. Most screening tools, including the PHQ-2 and PHQ-9, can easily be self-administered by the patient. If the patient will self-administer the screen, encourage the patient to leave a question blank if they do not fully understand it. Ask the patient if they have any questions before leaving them to complete the screening. If a staff member is administering the screening, be sure to ask the questions clearly and slowly. Once the patient has completed, or when you have finished administering the test, review the responses for completeness. If the test is missing response, offer to answer any questions the patient may have. What are the next steps once the screening has been completed? The paraprofessional can start by calculating the score on the screening test and documenting the results in the chart according to your office policy. You may then explain to the patient that the practitioner will review the results of the screen with him or her. A clinician, such as a physician, APRN, or PA, reviews the results with the patient and may ask additional questions to help formulate next steps. Examples of questions to ask after a positive screen. When did you first begin noticing that you were feeling depressed? Have you been feeling depressed some of the time or all of the time? Have you had thoughts of death or harming yourself? We will talk more about these additional questions in Module 5. Reassure the patient that the screen and any additional questions the practitioner may ask will be to help the doctor and patient to decide what kind, if any, additional treatment is needed.